Well, good morning, everyone. And once again, welcome to our Friday edition of Question and Answer. And hoping you're having a great day. And I'll wait for a few people to come on. And good morning, Lori and Fran and Andrea. Good morning to you, Maria and Nativity. Nice to have you on with us. Nazima. Where are you from, Nazima? Linda, Claudette from Rockland, Jerry, Denise, good to have you on. Judy, Roland, Sherry, and Pauline, and Kim, Christy. Okay. Good morning, Jeanette. Hope you're having a great day. Donna, nice to have you on. Monique, Rhoda, and Patricia. Jennifer, sorry. Nice to have you on with us. Andrea, Bruno. Okay. And Claudette is saying yes, hello. And Jeanette is on with us this morning. Jerry, Mame, and Debbie. Okay. Here we go. Joss, bonjour. And Lee, good morning to you. You know what? We got some good questions. And I was waiting for you, Yolande. Good morning to you. Carolyn, Maria, Lynn, from Moose Jaw, Saskatchewan. Margaret, Mary Jane, from all over North America. Good to have you on. Let's get going. We got a lot of questions. And this morning, Karen is asking about oil of oregano, what form I guess I like, or in... Look, all oil of oregano is good, okay? I'm a big guy on oil of oregano. I always probably tell my audience, they owe me money. That this is a true story, by the way, that when I had my radio show for 20 years in Northern Ontario, the sales of oil of oregano were the highest in all of Canada in Sudbury. They used to tell me that. The health food stores would tell me that. They get the highest sales of all Canada in Sudbury because of oil of oregano. Because I used to preach it all the time on my radio show. And so, you know, people ask me about antifungals, viral, antibacterial. It's a natural antibiotic. Wonderful. And I like it. Here's how I do it. I like it in a spray. Okay, so at the Martin Clinic, we have it in a spray form, 3 different forms of sprays. One is a throat spray, cherry flavored throat spray. First sign of a cold, sore throat, you know, COVID. I'm telling you, it's every bit as effective as anything else on COVID with vitamin D. Okay. Now, I would take it in we also have it in a sinus spray. Okay. I call it spray and pray because it's so strong. You're going to have to pray when you put that in your sinuses. Now, don't put straight oil of oregano in your sinuses, although you can. I like the spray because I find it just easy, but you can have it in drops, and you can put a couple of drops on your toothbrush. That's a tremendous way to do it. I spray my toothbrush, but you can put drops on it. And so we have it in pure spray, then we have it in a throat spray, and then a sinus spray. I love that. And I find, like, even for allergies, one of the best things that you can do is use oil of oregano. I love it. Okay? So thanks for the question. Very good question, Karen. Cynthia's asking about homemade kombucha. Hey, go for it. I like that. Got a lot of, it's a fermented food. It's going to give you bacteria, friendly bacteria. It's very good for you. I got no problem, especially the homemade stuff. Like just, folks, whenever you buy something in the store, like even yogurt, like you look at all that stuff, when they start adding sugars, when I don't like it. Okay, so that's why you never hear me talking about yogurt too much, because unless you make it yourself, I just find that, well, first of all, they have to pasteurize it. And when they're pasteurizing it, they're killing all the bacteria that are there. If it's on the shelf, it's pasteurized because that's the law in North America. You have to pasteurize it. And then when you pasteurize milk or yogurt or whatever, you're killing the bacteria in it. Okay. Janine is asking about cranberry juice. I am so happy, Janine, you asked about that. What do I think about it? I don't like it. I don't like cranberry juice. Now, I know it has benefits in terms of, you know, lining your bladder, and, you know, it's been used for a long time for bladder infections. Yeah. Use probiotics, they're better. Use an anti-yeast better. Cranberry juice is, I know it's, you know, even if they don't add sugar, it's too sweet. And sugar, to me, defeats the purpose of it, because you're now feeding candida, yeast. Ladies, what happens in the bladder? Almost invariable, if you get especially recurring urinary tract infections, you do not have enough friendly bacteria and you have an overgrowth of candida yeast. So don't add sugar, man. You're just feeding it. So I know it's, you know, and I found, you know, if you want something that helps, because that's what cranberry juice is supposed to do. It's supposed to help the lining of the bladder so E. coli doesn't sit on it. But you know what's better, in my opinion? Watermelon. Have a slice of watermelon. Don't drink. I don't like juice. It's full of sugar. Eat it. God wants you to eat fruit, not drink it. Okay? So that's where I come from, okay? So I would rather you use probiotics. That's the best way to get rid of urinary tract infections. Use oil of oregano. It's very, very antibacterial. And it's also anti-candida. It's anti-yeast. You got it all. Take it. That's why we put oil of oregano in our digestive enzyme, to kill bacteria. That's why it's so good to kill H. pylori and to kill SIBO, small intestine bacterial infection. So we add that to our digestive enzymes. So it's so effective, okay? So thanks, Janine. Very good question. What about the reset? Oh, Joanna's asking a question on the reset. Why is it, she's saying? Okay. Why is it that you can't eat fruits or vegetables on the reset? Very good question, by the way. And guess what? The book is coming out. We're going to make an announcement. Hopefully by next week, we make an announcement on the new book, The Martin Clinic Reset, the diet your doctor won't share with you. Your doctor's not going to share with you. Listen, I was on 2 days ago, I think. And just online, okay? So they were asking me, like, I said, look, I recommend you do the reset. You have this situation, the reset will really help you. And you know what? Like, then you know, the next day, I get a message. Well, will my neurologist like, you know, we got to pass it by our neurologist first. I said, oh, First of all, neurologists take about 5 seconds of nutrition in their medical school. I'm not trying to be negative. I'm just telling you, the vast majority of doctors, physicians, the vast majority, not all of them. I have some colleagues that are very, very cognizant of nutrition. They're experts in nutrition, but they took that after they got out of medical school. In the 70s, I took 2,000 hours of nutrition. And probably another 5,000 hours since then. But, so they said, oh, maybe I'm going to talk to my neurologist. Well, your neurologist, first of all, when they see eggs, meat, and cheese, neurologists, cardiologists, oncologists, you name the gist, they're going to go crazy because they got the cholesterol boogeyman. They got, fat not good for you. And, I get it. It's the way they're trained. And they say, well, go see a dietitian. God loved dietitians, but dietitians are stuck like Elvis Presley in the 70s. Remember Elvis Presley? He's dead. He died in 1976. I don't know if I've ever told you this story, by the way. I was going on Canada AM because I had written a book. I was being interviewed on Canada AM. They flew me to Toronto, treated me like a king, and then they bumped me. In the morning, it was going to be my segment. And guess what? The whole show, Canada AM, was on the death of Elvis Presley. He died the night before. He bumped me. Imagine. That was the first time I ever been on national television. They actually, what they did is recorded the interview and played it the next day. See, Elvis. But dietitians are stuck in the 70s. Oh, you got to have grains. You got to have, up on top of the food chain are fruits and vegetables. And, you have a little bit of meat and that's on the bottom of the, the pyramid. It's the other way around. But you know what I'm getting at. Like, they don't understand it. When I talk about eggs, meat, and cheese, they don't get it. So I don't necessarily recommend passing this by your doctor or your dietitian. I hate to be negative, but they don't understand. Now, let me answer your question. Why no fruits and vegetables? Well, and remember, this is temporary. Am I against fruits and vegetables? No, I'm not. But there's a reason for my madness, guys. I do this for a I do not want any carbs for 30 days. I want to send your pancreas on a holiday. Now, I know that vegetables, most of them, and even fruits, when you eat them and not drink them, are pretty low in terms of their sugars. I get that. And carbohydrates. There's not many, but I don't want any. And there's a reason for it. I want to reset the body. I want to reset the pancreas. I want to empty out the liver completely. And you do that when you're not eating any carbohydrates. And by the way, one way to heal your gut, like this might, because, and I talked to you about it in an earlier podcast, is fiber is overrated. Doc, I gotta have my fiber. I'm not gonna go poo. It's overrated. It irritates. If you already have an irritated bowel, the worst thing you can add to it is fiber. Fiber is roughage. And especially insoluble fiber. You know what the word insoluble means? It means that you don't absorb it. You know where it goes? It goes into the toilet. Well, if you're going to eat something that's going into the toilet, oh yeah, but doc, it's scrubbing my bowel. Yeah, leave your bowel alone. You don't need to scrub it. Your bacteria will do that. That's why don't scrub away all your bacteria. You have no idea over the years how many people, especially women, who had diverticulosis or IBS, and they live on chicken and salad. Salad and chicken. I said, quit eating that salad. What? I said, you're not a rabbit. You know why a rabbit eats salad? First of all, does not have a gallbladder because they're herbivores. And they have an enzyme called cellulase. You don't. Human beings are carnivores. It doesn't mean we can't eat any vegetables, of course, but you do not have you do not have an enzyme called cellulase to break down cellulose, which is found in your salads. Oh, you ladies. Okay, but, and I'm not telling you never to eat salad. Okay, I'm not. I'm just telling you, if you got an irritated gut, quit eating all that roughage. You don't need it. Okay? So it's a temporary program. To answer your question, Joanna, it's a temporary program. Get off the vegetables, get off the fruit. I don't want any extra roughage. I want your body to reset itself. And I'm telling you, it works. Just go on the Martin Clinic private Facebook group and look at the testimonies. Incredible. Guys, I'm going to tell you something. I will put that, ask me about any diet in the world that came out in the last 50 years. Anyone. I'll give you the Coles Notes version of what it is. I will put up the reset. And I've written books on diets. Okay? What was one of them called? Nature Slim. The Healthy Way to Lose Weight. That's going to be 30 something years old. I can hardly remember what I wrote. Okay? But in keto, you guys talk about keto. Well, keto's been around for a long time, guys. It didn't just come out in the last few years. And the reset is not a keto diet. It's different. It's different than a keto diet. You will burn ketones. The vast majority of people, you will change your fuel and burn a better fuel for sure. But this is not really a keto diet. Because a keto diet allows you a certain amount of carbohydrates. About 20 grams for, up 50 grams for men sometimes, and depending on their makeup, and women about 20 grams. You don't get away with lots. This is 0 grams. I'm sorry. 30 days. 30 days. Okay, Joanna, very, very, very good question, okay? And she's asking about, I'm doing food and that before I get to conditions and supplement. Anne is asking about our Rivera, okay? Guess what I have right here? See it? She's saying, do you have any studies? Well, look, I haven't done any study. I don't do studies per se. I've done a couple of them, okay? I did a study on chronic fatigue syndrome. That's how I got my PhD, when I got my PhD in nutrition, okay? And then I got another PhD in natural medicine. But the one that I did on nutrition was based on chronic fatigue syndrome. So I did a research. I had to. It was part of my thesis. But Rivera, the ingredients in here, okay, remember it's a formulation. We got, what, 6, 7 different ingredients in there. The primary thing that makes, okay, Ann, the primary thing that makes Rivera so good, okay, is pine bark. So you take pine bark internally through Navitol in Canada and in United States, it's Navitol, okay? That's a pine bark extract. That is our exclusive blend. That's how many years I've been doing pine bark extract. In Europe, it's called pycnogenol. Okay, even in North America to some extent, but ours is a much better blend. But we use pine bark extract in here and hyaluronic acid. That's what gives you beautiful skin. And this is a natural sunscreen. It protects you because it's a very powerful antioxidant. But like, I haven't done any, like personally, I just give you clinical experience with pine bark. And again, the testimonies, the reviews on that product, and are tremendous. Like, I'll tell you what, okay? And I mean this. You can go and get $300 product at your pharmacies or at your big box stores or whatever. You ain't gonna get a better product than this. And I don't mean to advertise like that, but I'm gonna do it because you asked me the question. Okay, I mean that. Okay, Sherry, what about apple cider vinegar? I like it. Look, I'm going to say 10, 15 years ago, apple cider vinegar was good. There's always things that come on the hit parade, I call it. And all of a sudden it is, apple cider vinegar, from cancer to colds. It fixes everything. I used to get patients come into the office and apple cider vinegar, like it fixes warts on your nose. No, it doesn't. Okay. And like Mother's apple cider vinegar. I used to get that question when I had my radio show every Thursday on my radio show. And I said, well, I like it. Apple cider vinegar. You know what it's effective for? For your stomach. When you have low acidity and you have acid reflux. When you have acid reflux, it's not because you got high acidity. You actually have low acidity in your stomach, and your stomach, your proton pumps are trying to push out even more acid because you don't have enough. And guess what? It sends it up your esophagus, and now you have acid reflux. Well, apple cider vinegar is good for that. I like balsamic vinegar. A little bit of teaspoon of balsamic or apple cider. I like that to help with your digestion. Now, apple cider vinegar does not replace digestive enzymes. It doesn't. But I like it. Okay, but it's just not like, sometimes you'll go online or whatever and, apple cider vinegar, man. No. No. It doesn't do everything it says it does. Okay, but I'm not negative on it. I got no problem. If you want to use it, go for it. But you're going to lose 50 pounds when you take apple cider vinegar. Guys, don't believe that for 5 seconds, okay? No, but it's good for digestion. I like it, okay? So there I go. Okay, now, conditions. Kathy's saying, can you talk about pancreatic cancer? Well, I could do a whole show on pancreatic cancer. Maybe I will. But let me just give you a very short version. First of all, pancreatic cancer, I hate to use the word epidemic, but we have an epidemic, really. Pancreatic cancer at one time, when I was in the 70s and the 80s, and the 90s even, pancreatic cancer was a rare cancer, very deadly. Our friend our friend. One of the, a Sudbury boy, Alex Trebek, died of pancreatic cancer. He survived it a little bit longer than people had anticipated because it's usually very deadly. There's no real treatment for it. But why do we see so much of pancreatic cancer today? Can I tell you why in a nutshell? We're carbaholics. We're carbaholics. You're overusing. We talked about insulin. We use so much stinking insulin. The good cop, bad cop. Remember that? Teaching a couple of days ago. You need insulin, but when you overuse it, you're stressing that pancreas like big time. And here's another thing I'm going to say. Okay? Like I said, I think I'm going to do, well, listen, I actually did. If you go back on a podcast, this is, well, I think Alex Trebek, the first time we heard about it, was it 2 years ago or not? Maybe not quite that long. And I did a podcast on what would I do if I was Alex Trebek? And I'll give it to you in a nutshell. Stop eating sugar. And remember, carbs are going to be sugar in 5 seconds. You have cancer, stop eating sugar. Sugar feeds cancer. Sugar feeds cancer. Cancer needs fuel. Quit feeding it. Dr. Martin, I got a juice. I hear juicing is good. No, it's not. Don't do juicing. I'm against juicing for cancer. Don't juice. You're just feeding cancer. Well, yeah, but Dr. Martin, it's celery juice. Yeah, not for cancer. Eat celery. Don't juice it. Okay? And I know that's controversial, even there, because you get so many gurus. So many of my colleagues will tell you, oh, drink carrot juice. No. Don't drink carrot juice. You can eat carrots, but don't drink carrot juice. And I don't want no carbs, hardly at all. I would put someone that got diagnosed with cancer, put them on the reset. Eggs, meat, and cheese. Okay? So, pancreatic cancer, I think it's Carrie. I think it's Carrie saying, what about low blood iron? Okay, here we go. What are the causes of low blood iron? Well, usually, I often see it, it's part and parcel with anemia. It's a couple of things. One, oftentimes estrogen dominant. Women are so susceptible, especially if they have too much estrogen. Their menses can be a real mess. They bleed so much and they lose so much blood and the body just never recovers from that. And some people, because they don't, when you're low iron, you know how you get heme iron? Do you know how you get heme iron? Is eating steak, So eating steak, vitamin S. So, it's so important to understand that, okay? So, other causes could be, just the fact that you're a vegetarian or a vegan. You're going to get iron in some vegetables, but you're not getting heme iron. H-E-M-E. Heme or Hemi. You think of the Dodge truck, it's got a Hemi engine. That's spelt with an I. This is spelt with an E. Heme iron. Okay? Now, pancreatic cancer, we talked about low blood iron. Louise is asking about high blood pressure. Well, there's a couple of things that cause high blood pressure. The number one thing of high blood pressure is Insulin. You want to get your blood pressure down, you start with a diet. Now somebody, like I know, don't blame salt for what sugar does. Now salt can elevate your blood pressure. We talked about this in the past. But salt will only elevate your blood pressure if you are dehydrated. So a lot of times what insulin does, it affects the kidneys. The kidneys can elevate your blood pressure. So it's a good question. But when you change your diet and when you drink vitamin W, which is water, your body needs a minimum of 2 liters of water a day, and nothing else is water except water. Remember that. Nothing else is water except water. Coffee's not water. Tea is not water. Juice is not water. And even Perrier is not water. Now, I like Perrier. I do. But I drink water, and I like a little Perrier. Okay? But it's not water because it's carbonated. And when it's carbonated, it's acidic. Okay? So you need H2O. Otherwise, that's one of the major causes of high blood pressure, is a lack of water. Your kidneys are Niagara Falls. They need water, water, water. You go to Niagara Falls, what do you see? Wouldn't it be something if you went to Niagara Falls and, oh, geez, I guess it took a day off. There's no water coming over the falls. Well, that never happens. Think of your kidneys. 7 days a week, 365 days a year, your body needs water, okay? And you need 2 liters. That's, for my American friends, that's 64 ounces. Minimum. Start there. And make it a habit, because you can make water a habit. Oh, Dr. Martin, I don't like water. Men, they're big babies. I don't like the taste of water. Well, too stinking bad. Suck it up, buttercup. You need to drink water. You got high blood pressure. You want to have a stroke? Yeah, but I like my Pepsi better. Yeah, I know you do. Ooh. Okay, Jane's asking about water retention. Okay, well, look, that can be a couple of things. One of the biggest things in water retention is dehydration. You might think, oh, no, doc, I'm not dehydrated. Well, then if you got water retention, you got circulatory problems, or you're starting to get congestive heart failure. And that's one of the signs. If your ankles are swollen all the time and that water retention, well, your body's smart. You're probably dehydrated. And so that's how you get rid of that. Make sure you're drinking enough water. And, obviously you could have some medical conditions too. Natalie's asking about uterine fibroids. Well, Natalie, listen, uterine fibroids are caused by estrogen dominance. So what do? Block your estrogen. Get on our hormonal formula. Block that extra estrogen. Ladies, you're not low in estrogen. When a doctor tells you you're low in estrogen, you're not. You're not. Oh, doc, I'm in menopause. I must be low in estrogen. No, you're not. You're low you have an imbalance between estrogen and progesterone. That's what you have. And I never worry about estrogen. You won't see me giving people estrogen. I don't recommend it. There's estrogen in everything. Every chemical looks like estrogen to your body. Women, you're so susceptible. Even men. Men at the age of 50 have more estrogen than they have testosterone, for heaven's sakes. There's so much estrogen. Okay? Cheryl's asking about hiccups. Well, you know what? Usually in there, you got hiccups, you got low acidity in your stomach. It's just a symptom. It's another symptom too of a lack of enzymes. So you need those digestive enzymes, okay? Jerry's asking, what's a good reading for B12, hemoglobin? Well, listen, and Suzanne is asking the question part of it. What if you're low in B12 and hemoglobin? Well, B12, I like between, when I look at blood work, I like your B12 to be between about 800 to 1200. If it gets a little bit higher than that, I usually stop a patient from actually taking B12. But, you know, you're at 500 and you go, oh, gee, that's high. No, it ain't. 600. No, it ain't. It's low. That's not high B12. I like optimal levels of B12. And we talked about this, how important B12 is for your body, okay? And hemoglobin, I like 13 to 17 for men. Women about 12 to 15. But even then, I don't look at the numbers as much as I look at, I look at people to see their complexion and their pallor in their face and this and that. I can tell a lot just by being observant. You know, you're pale all the time, you got low hemoglobin. You need to eat more steak. There you go. How do you get hemoglobin and B12? Steak. Jean's asking the question. They did the reset. It's Jean or Jean. Blood sugar when the doctor wants to. Look, good question. Sometimes, guys, numbers are overrated. Like, when you ask me for numbers, blood sugar. Have you ever heard me talk about blood sugar numbers? Nah. Like, I like your average, your A1C. I'm interested in that. That's a 3-month average of your blood sugars. But other than that, doc, I take my blood sugar. Diabetics, they're taking their blood sugar 20 times a day. I said, you're driving yourself crazy. It's like taking your blood pressure all the time. Why are you taking your blood pressure every 5 minutes for? I don't like that. Even diabetics, I got to check my sugars. How are you feeling? Oh, I feel good. Well, then why are you checking all the time? Now, I know that goes against the grain, but you're stressing yourself out. Oh, I'm not at 5. Yeah, but your 5 might be somebody, you know what I mean? If you feel real good, I'm more interested in that than you taking your blood sugar every 5 seconds or your blood pressure every 5 seconds. I had people, they brought me, I used to remember in the clinic, they used to bring in, they had about 3 months, 10 times a day in columns. And they said, Doc, what do you think of my blood pressure? I said, you're getting my blood pressure elevated just by showing me 10,000 numbers. I said, you're not going to die of high blood pressure. You're going to die of a heart attack from taking your blood pressure every 5 seconds. I said, you're elevating your cortisol. Anyway, look, I know I'm a little different, but that's the way I think, okay? Now, Allison's asking about histamine intolerance. Now, you know what, Allison? That is, if you have histamine intolerance, meaning your mast cells, M-A-S-T, are secreting too much histamine, right? And you have an intolerance to it, and then they have, on the internet, you'll see diets for it. I don't believe it. I'm sorry, I don't believe it. If you have a histamine intolerance, you have leaky gut. Fix your leaky gut. Eat eggs, meat, and cheese. Don't feed the bears of candida, because that's what throws histamine off, in my humble opinion. And you got leaky gut. Fix leaky gut. I've never seen, what they call histamine intolerance, that they don't have leaky gut. Okay, Henriette asking, what causes low potassium? Well, usually kidney problems are liver problems. If you have constantly low potassium, you got problems with your kidneys. Get your insulin down. You start with food. And even the liver, because you can have a start of fatty liver that can lower your potassium levels. Okay? Patricia, what about ringing in the ears? That's tinnitus. That's a sign that your insulin's too high. You got insulin resistance. Okay. Really good questions. Sorry for my ranting. Have you found out that I'm a little bit opinionated? I got my ideas. I'm pretty stubborn. Okay. Thanks for watching. Please join our Martin Clinic Facebook group. Announcement coming very soon on the book. So get ready for that. And if you have any topics that you want me to cover, hey, send them along. I'll see if I can cover them for you. Okay? Love you guys dearly, and I mean that. Take care for my American friends. Happy Thanksgiving sort of weekend. It's Black Friday. Get out and shop. Okay, love you guys.